and welcome to Health Show with Amara from our London studios. I'm Dr. Amara Sohail. In today's show, we are going to unravel the mysteries, the challenges, and the triumphs of one of the most critical medical emergencies, stroke. Our guest, Dr. Habib Haider, is going to talk about the complexities of this particular condition, the management, and how to diagnose it. Let's welcome Dr. Habib Haider. Thank you very much, Dr. Haider, for joining us today to talk about a very, very important medical emergency. So before we do that, I would like you to tell our viewers something about yourself, your journey into your career.
Thank you, Dr. Amara, and thank you, Quews, for giving me this opportunity to talk about it. As you said, I'm a consultant in acute medicine. I'm also the executive council member of APNE, which is the largest democratic association in UK, basically. When I came to UK, I started my journey in terms of doing training. I did my initial training in East Midland Deanery and did my CCT in acute internal medicine, general internal medicine, and stroke medicine, where I developed in terms of interest to do in terms of doing something in specialization point of view for a stroke perspective. So I did my fellowship there. Currently, I'm working as a consultant in acute medicine, and I have lots of doing educational health at the same time. I'm doing RCP college tutor and I'm RCP examiner for the West Midland Deanery, because education is always my passion. That's why I do the same role in APNE as education lead there. And as people have a lots of in terms of awareness things regarding the stroke perspective, and today's topic is very, very important because the stroke is completely changed in last 10 years. And that's
so what is stroke?
So stroke is basically a condition which you can say like a brain heart attack. It's result due to lack of blood supply when the brain area is dead and can result in the loss of function related to that area. So basically stroke is mainly of two types. Sometimes we call it ischemic in medical terms when people have a lack of blood supply to that area. And the other is hemorrhagic stroke, which means the bleeding. It can compromise the nerve ending and can result in loss of function.
And why does it happen? Are there any risk factors that some people are more vulnerable to this condition?
So stroke has a quite complex risk factors, even it's starting with the daily lifestyle. So I will concentrate in terms of daily lifestyle like smoking, alcohol, lack of exercise, too much fatty diet, cholesterol, and then if you come to the medical risk factors, then related to the diabetes, which is one of the very common risk factor, and high blood pressure, and sometimes inborn error of metabolism can result in a stroke, which we can label as a young person stroke.
Yeah. So how common it is in the younger population?
So younger population is getting now unfortunately slightly more common in recent time due to lack of in terms of certain activities like a lifestyle changes, but unfortunately due to some inborn error of metabolism can put them in more risk for the stroke. Otherwise normally labeled as always a old person disease after 65 or 70 years of age due to diabetes and hypertension. But unfortunately due to modern times people have a hectic lifestyle, stress level is high for everyone. So now we are seeing unfortunately more and more stroke in the younger generation as well.
Yeah. And how do people know that they are having a stroke? What are the common symptoms that patients experience?
So this is a very important question, and I think it's very in terms of helping to highlight this. If you look in terms of the posters all over, in terms of shopping center on the roads, called FAST, F-A-S-T. So F mean facial, like a face, weakness of the face. A is a loss of power in the arm, like a weakness of arm. And then S is a speech problem. So if somebody notices that they have difficulty in finding words from the speech side, or if they have a face droop on one side, or they have a lack of power or loss of power in one of the arm, including leg as well, then they need to call 999 because time is brain. Because the first few hours management of strokes are very, very crucial.
And first few, as soon as this medical emergency starts, people should be aware of these symptoms. And you said they should call 999 for help. So how do you manage then? Because when they start experiencing these symptoms, does that mean that the damage has already been done or it can be fixed?
So thank you for answering very important question once again. I think that management of the stroke or horizon of a stroke has completely changed in last 10 to 15 years. Previously, people used to say that if somebody has a stroke or if somebody suffer from a stroke, the only thing which we can do for them is rehab, like in terms of help them in terms of their mobility or daily lifestyle. But now we're talking about in terms of stroke, in terms of different categories, to what we call first few hours on management of stroke called hyperacute stroke management, which means if somebody has these symptoms, which we discuss in terms of false symptoms, then they need to call 999. Then they're going to reach to the hospital within hours. So if they reach to the hospital within 4 to 5 hours, basically then they're going to do scan of the brain when they look for possibility of type of stroke. Either it could be due to lack of blood supply or could be a bleeding. If there's a lack of blood supply, then always the risk is blood clot. So then they're going to have this clot busting drug, what we call thrombolysis. Thrombo means blood clot, lysis means a breakdown. Plus, they also introduced recently a method called thrombectomy. As the name indicates, thrombectomy, thrombus is a blood clot, ectomy is the removal of blood clot. And that's the reason it's completely changed the life of certain people, those who have a stroke. Because previously people think that if they have a stroke, they're not going to gain their function, they're not going to gain their power, they're going to end up in like a handicapped position for the rest of their life. But due to these recent advances in the treatment, people can gain their function and can spend a normal life. And then after that, we're going to monitor the first 24 to 48 hours are very crucial in terms of treatment wise. Look for blood pressure control, diabetes control. And then we talk about the rehab. Then we have the rehab thing, which we can do in terms of physiotherapy or multidisciplinary, which means the different professionals, occupational therapists, physiotherapists come and help them. So I think this is a really big change in medicine now.
That's great. And you mentioned that a stroke can be due to a blood clot and it could be due to bleeding. So which one is more risky? Is it the clot one or the bleeding one?
So I remember on this occasion, one quote, when I started my stroke fellowship, one of the consultants said to me, Habib, if God give you a chance to have a stroke and say, choose either ischemic stroke, lack of blood supply or bleed, what do you prefer? So we have seen lots of patients in terms of during that time, we thought probably the ischemic stroke is the worst one. But unfortunately, ischemic stroke is the worst one in terms of the prognosis wise. But the bleeding, either people can survive or they gain their function. But due to recent advances, if somebody had a stroke, they need to first pray this could be ischemic, but then they're going to pick in within few hours, so they can have thrombolysis or thrombectomy. Because if they have a stroke result secondary to bleeding, then most common cause is high blood pressure. So they need to make life changes in terms of like high blood pressure point of view, like medicine intake, diet wise, reduce salt intake, and also do exercise in terms of maintaining their BMI, like weight under control, to avoid this risk factor.
And so would patients know what kind of stroke they are having just by the difference in the symptoms, or it's the same symptoms?
So unfortunately no, because as you can imagine, brain is very complex structure. If somebody has either is a bleeding in the brain or a blood clot, it can result in loss of function.
So it's only once they reach the healthcare facility, only then the diagnosis will be made after doing the test. Mainly, you said the scan.
So yes, mainly the scan. But having seen that, in Europe they introduced this ambulance, which they have. If somebody has a stroke, they're going to call 999. The ambulance reach there, and at the same time they have this like scanner in the ambulance. They're going to do the scan by the paramedics. They're going to send images of that scan to a doctor or a person who is responsible for this treatment for thrombolysis, and they will decide and they give the injection in the ambulance. In UK, we still have the same system that we need to bring to the hospital, have a scan, and take it from there.
It's very fortunate that we live in UK because this kind of facilities are available, but unfortunately not all countries they are that privileged, and especially in developing countries we see a lot of young deaths as a result of stroke, which is not managed in a timely manner. So you mentioned about the lifestyle modification. Do you think that people nowadays are more conscious or aware of these adjustments in their lifestyle to prevent this kind of conditions, or it is actually on the decline?
I think that people have more awareness now in terms of their lifestyle. But at the same time, as you know, the recent advances in the world, including the technology world, in terms of doing most of the time on computer and then avoiding to do any physical activity, then unfortunately it's like a balance between their life and working routine.
So, but although I mean, we can say that there is more trend towards the sedentary lifestyle, but at the same time, I see a lot of younger people. They are more health conscious. They avoid, like in Ramadan, especially where we are eating samosas and pakoras. A lot of young people, they avoid eating such things. So I personally think that there should be improvement in the awareness, but at the same time, what is the trend that you see in the hospitals? That you see, do you see more cases or it's on the decline?
So we have seen cases of the stroke in recent time, but I agree with you basically because diet is one of the thing. But if somebody unfortunately has a diabetes or like what you call as high blood pressure, but plus if they have like in-border error of metabolism, which we cannot get rid of unfortunately due to family history, then they cannot avoid these things. But I agree with you, the younger generation is more and more aware about these things, and they're trying to make certain changes in their lifestyle to avoid those risk factors can lead to stroke.
So, but I don't know what your opinion is. I feel that older people they always think that as they're getting older, their physical activity should reduce because they should not overdo, because that may result in problems with their heart and all that. Do you see that this is the general public impression that they should reduce their activity because of the advancing age, or how can we make them aware of all these things?
I think they need to make a balance between, to be honest, because age is only a number. How are you going to spend your rest of the life? Then you can see. And we have set an example. I think it's just because of people think that they are actually over 65 years age or something, they're going to stop things. They should not do that.
And so one thing is the prevention at the time, but lifestyle and this exercise and all that, that's what are the basic principles of secondary prevention?
So secondary prevention mainly for the stroke perspective is diabetes. If somebody has a diabetes, then you have strict blood glucose control, high blood pressure, cholesterol, no smoking, alcohol, and exercise. Because primary prevention happen in terms of when they have a stroke, like a procedures, thrombectomy or thrombolysis. Secondly, started with a lifestyle, but exercise is very, very important role. Even for the stroke, because the stroke is not only sometimes people can have a stroke, they can have a heart problem at the same time. So they need to look for those.
So with exercise, you mean gymming, or it could be any other exercise, brisk walking or running?
I think people say normally they do like a 30 minutes, 45 minutes to 60 minutes exercise, which include even brisk walking. They can walk on the treadmill if they want to. They can do a small jog. They can do that. This not means that you need to go to gym and doing bodybuilding and like a weight and strain exercise doesn't mean anything. You just need to make sure your heart muscle getting regular for supply of the blood, and then it will help in terms of creating collaterals. And heart has a function to supply blood to the brain as well. So that's why I think it's going to be help if people do even small exercises.
And in general population to for the when you assess or screen, is there any screening tool for patients who could be more vulnerable, especially if they've got a family history or if their lifestyle is such that their body mass index is very high and things like that? Is there a way to screen their for their risk?
So we can't risk factor for the stroke, unfortunately, but we have a Quews score for the heart problem, and the heart problem is one of the major risk factor from the stroke perspective. But yes, if somebody has a family history of a certain type of stroke, then there are some biochemical blood tests you can do to look for possibility of those conditions, which can result in young person stroke.
And when you mentioned that when patients they experience these symptoms, they should call 999. So this stroke service is 24/7. It's always available, or it is like only if they are lucky to have it in the daytime that facility is available?
So stroke team is available 24/7, but unfortunately thrombectomy, which is the more advanced method in terms of removal of blood clot, is available in certain times in the all UK hospital. But most of the time between working hours, it's always available.
Oh, that's good to know. And one thing which keeps coming up, that whatever medical condition we talk about, all the experts, they actually talk about lifestyle adjustment. So it's almost like back to basics, that healthy eating, exercise, and avoidance of the sedentary lifestyle. That is very relevant. So, what advice would you give to our viewers for the stroke prevention, or even for any prevention of any other medical condition, including the heart disease?
I think prevention is better than cure. I 100% agree with you, and this is the main message for the whole population basically. So main thing is diet and exercise. So you need to make in terms of moderation in terms of diet, avoid oil or saturated fats. Think about in terms of using fried thing, which we're using unfortunately quite a lot in Ramadan, but you need to think about in terms of precautions wise. But most important thing is exercise basically.
Yeah. And you mentioned smoking as well. So nowadays we see that people are aware of the health risks due to smoking. So they are now changing it to vaping. So do you think vaping is better than smoking, or is it safer?
Unfortunately, few articles say that vaping is more dangerous as compared to smoking.
Really?
Yes. So I think definitely people have no other choice just to stop smoking, and which means stop even vaping as well.
Really? So that is absolutely a news to me, because we see a lot of patients who say, "Oh, I don't smoke anymore. I vape." So
Yeah.
the message is that the current evidence is that it is as dangerous, if not more, compared to smoking.
Yeah.
So thank you very much, Habib, for your insightful session today, and I'm sure our public will benefit from all your advices. Thank you very much.
No, thank you so much, Dr. Amara, once again, and thank you, Quews, for giving me this opportunity. Thanks, Doctor. Thank you.
So, viewers, you heard Dr. Haider talk about stroke, symptoms of stroke, and what should you do in order to avoid having such medical conditions. So, back to basics: healthy lifestyle, exercise, fat-free diet, and avoidance of smoking and alcohol. So that's all for today. We'll be back with another health topic next time.